Styles of Teaching Part 3, Independent Learning. The objectives, importance of independent learning, benefit of independent learning for students, independent learning in curriculum, learning resources in independent learning. The importance of independent learning. Students and trainers should be given more responsibility for their own learning. The learner may require support and direction. This approach has an important part to play in medical education and should be integrated into the educational program. There has been a move from teacher-centered learning to student-centered learning. The greater use of strategies such as team-based learning, electives, and problem-based learning draws attention to the importance of independent learning. The excessive use of lectures as a learning experience has been criticized, and there is now more awareness to alternative learning strategies such as flipped classrooms that can be used. The move to an outcome-based model where the learning outcomes are transparent. There is an increasing focus on distant learning and hybrid model that incorporate face-to-face and distant learning. Independent learning by the students is a key feature. Students now learn outside of the medical school, including in the community, the district, hospital, and clinical skill centers. As a result, they have to take more responsibility for their own learning. The learning can be matched to the need of the individual student. The need for lifelong learning and continuing professional development is recognized. Advances in technology and internet development have resulted in rich and powerful learning experiences becoming available. Benefits of independent learning for students. They can choose to work at their own pace, spending whatever time is necessary to achieve the required mastery of the subject. They can decide when and where they study. This may be in the workplace or at home. They can tailor the content of the learning to their personal learning needs. They can select the method of learning and an instructional design that best suits them. They can engage to a greater extent in deep learning and reflect on the subject as they pursue their studies. They can monitor their own progress using appropriate learning resources and adjust their continuing learning based on feedback received. Independent learning in the curriculum. Time allocated for independent learning and scheduling in the curriculum. As a replacement for activities such as lectures, it may be used as a substitute for lectures when a new course is planned or to replace lectures in an existing course to allow student time for other activities. As an alternative option of student attendance at a lecture, as an adjunct to an existing learning opportunity for revision or remedy process. Directed self-learning and the role of teacher. The teacher role in independent learning differs from traditional teaching, of course. There is a switch in emphasis from the teacher as the information provider to the teacher as facilitator of the student's learning. The teacher needs, in that case, to be familiar with the learners and the potential problems they may encounter when working independently. Study guides. The concept of study guides in print or electronic format to support the student's learning can play an important part in independent learning. The design and contents of study guides varies depending on its use. The study guides may help students develop the necessary study skills to gain maximum benefit from independent learning. Learning resources in independent learning, such as online resources, recording and broadcast of lectures, DVDs, books and journal articles, curriculum map, models and simulators, patient trials, simulated and virtual patients. All these kind of patients can be used for learning if they are real, simulated, and virtual patients. The choice of learning resources will depend on the expected learning outcomes, the resources available, and the technology support. Teachers may wish to create independent learning resources for use by their students. It can be a demanding task and is best undertaken in collaboration with an educational technologist or colleagues who has experience in the technology and instructional design. Just providing students with recordings of teaching sessions is not a satisfactory option in that case. Feedback should be provided. This is a very important point. Learning should be active rather than passive, and the students encouraged to reflect on what they have learned. Students should be able to individualize the resources to meet their own personal needs, and the content should be relevant and matched to the specified learning outcomes. For your listening.